Hello everyone, and welcome. I'm Emma, your host from Potential.com, and today we're diving into a topic that couldn't be more urgent or exciting: how AI is transforming healthcare. From reducing patient wait times to supporting doctors with instant insights, AI agents are already making a real difference in clinics and hospitals, and we're here to show you exactly how. In just a moment, Rachel will catch us up on the latest in AI news and share a new book recommendation you won't want to miss. Then our co-founder, Shadi Banner, will walk you through how AI agents are being used to triage patients, cut admin overload, and deliver smarter, faster care. We'll follow that with a few demonstrations of our tools in action, and end with a live Q&A during our AI clinic to answer your questions and explore how these solutions can work for you. So stay with us and drop your thoughts in the chat. And to everyone watching us live on YouTube and LinkedIn, make sure you're subscribed and following our channels to stay updated on all things AI. Now, let's dive in.
Let's take a quick look at where AI in healthcare is headed, and the numbers are wild. According to Grand View Research, the global AI healthcare market is set to skyrocket, projected to hit over $200 billion by 2030. That's massive growth in just a few years, showing how fast the industry is embracing AI to boost efficiency, reduce costs, and deliver better care. So if you're in healthcare and thinking about AI, now's the time to get ahead of the curve. We've got to talk about Canva, because they just dropped some seriously impressive updates at their latest Canva Create event. Their new Canva helping you brainstorm, build, and polish content faster than ever. And with features like Magic Expand, you can stretch images in any direction, fix framing issues, or transform a portrait shot into a full banner in seconds. They've also taken Magic Studio to the next level, letting you generate everything from social posts to videos at scale, right inside Canva. Long story short, design just got a major AI upgrade. And here's a bold move from China that's turning heads in the education world. Starting this September, AI literacy will be a mandatory subject in Chinese public schools. Students will learn how to interact with AI tools, craft effective prompts, and build digital skills that actually match the future they are walking into. It's a big step toward preparing the next generation, not just to use AI, but to understand it. Next up, Google just dropped something big. They've launched Firebase Studio, a free tool that lets you visually build full apps without deep coding. It's fast, intuitive, and built right into the Firebase ecosystem, so you can design, connect, and deploy your app all in one place. Whether you're a solo creator or part of a team, this could seriously speed up your workflow. Alright, this next one is seriously next level. ByteDance just revealed OmniHuman 1, and it's one of the most advanced human video generation models we've seen so far. With just a single image and a bit of audio or video, it can create ultra-realistic full-body animations, lip sync, gestures, even emotional expression, all in real time. Whether it's making someone sing, speak, or dance, the results are so lifelike, it's hard to believe it's AI. And get this, it even works with cartoons, animals, and objects, not just people.
What would art be like without emotions? It would be empty. What would our lives be like without emotions? They would be empty of values. So a famous classical poet said, "We hate and we love. Can one tell me why?" Catullus. Science does not answer why questions.
And to wrap up things, ChatGPT just got a major memory upgrade. It used to remember a few helpful details. Now, it remembers everything: your tone, preferences, past conversations, how you like your answers, all to make your experience smoother and more personal over time. Total game changer for anyone using AI regularly. And if that sounds a little too intense, don't worry, you can view what it remembers, turn memory off, or clear it anytime. Before I wrap up, I've got a highly relevant book to recommend this week, especially for those of you in healthcare. It's called The AI Revolution in Medicine, GPT-4 and Beyond, by Peter Lee, Kerry Goldberg, and Isaac Cohan. This book takes you inside the world of medical AI and shows how large language models are already transforming diagnostics, research, and even patient care. It's not just technical, it's grounded in real stories and real use cases, which makes it both eye-opening and easy to connect with. That's it from me today. See you next week with more AI updates and another book worth your time.
Hello, everyone. Welcome to this week's session, where we're looking at how AI is going to empower the healthcare sector. So I'll start with a question that I'd like to ask you, and that is about your preference. If you had the choice of seeing an amazing doctor that's really good at what they do on their own, or to have the same amazing doctor accompanied by some amazing AI resource that has the latest knowledge about all medical practices around the world, has in their training data all of the key medical literature and scans and reports and studies that have been done. Would you prefer to have one of them, or would you like to have them both? I'm sure you'd say that it would be good to have both. And especially when we're not always dealing with the most amazing doctors. Sometimes we're not lucky enough to have the most amazing doctors around. However, with the AI, we can ensure that we have pretty good quality of AI. It's only getting better and better as we move forward. But having both the doctor and the AI can really provide an amazing healthcare experience. And soon I predict it will become illegal for doctors not to use AI, given how much AI is becoming much better than doctors at actually pinpointing certain aspects of, the scans, being able to identify trends in data, being able to pinpoint issues that could be wrong, that might be too small for a doctor to notice, or the doctor might be too busy to actually take the time to really evaluate various intricacies of things coming in together. This is where AI can play a big role, and it's already in an amazing state, and it's only going to get better and better. So this is why I predict very soon, probably in the next couple of years, that you wouldn't accept that your doctor not use AI, and it might be in some jurisdictions illegal for them not to use AI to support their work. So today we're not going to necessarily talk about the medical aspects of using AI inside a hospital or healthcare clinic. We're going to focus more on something that affects us all as patients. So we'll look at the patient experience and see where can AI help in improving that patient experience. And this can be applied across all kinds of aspects of the healthcare sector, whether the hospitals themselves or the clinics or doctors interacting, or even medical pharmaceutical companies, medical websites. Any one of these aspects of the healthcare sector can benefit from this discussion, and we as patients, all of us as patients, can also start to see what's available to us. So let's walk through together this patient experience. And it usually starts with us having some questions. We might have something that we've recently felt is weird, we're not used to, or some pain somewhere, or something that has changed, and we just have some questions we'd like to ask, a doctor about these things that we're going through. However, not everything warrants a visit to a doctor. Sometimes some of us don't like to necessarily go and do that visit to the doctor unless it's something really serious. But we do have a lot of these questions. Luckily now, we also have the ability to ask these questions to a virtual, real-time AI doctor. This is one of our clients. So everything I'm going to show you today is not something that's futuristic. It's something that's being applied today by some of our clients. So this is an example of one of the use cases in one of our clients where they're using a virtual doctor to be the first level of interaction with patients, to answer any questions that they have, guide them in terms of where they could go for more in-depth analysis if that's warranted, if they need to do some lab tests, if they need to take an appointment with a doctor, etc. This virtual doctor will sort of give them that direction and address some of the common issues where, like, if someone is facing a headache, what are the other things that they might be going through? And if it's doesn't look like it's serious, the virtual doctor might tell them, look, wait until tomorrow. If you don't feel better, then probably, go see a doctor. But it looks like it's, it's not that serious based on this one symptom that you've given us. So it could address some of the lighter aspects, and for things that could be, warranted or would require a visit or some extra lab tests, this virtual doctor can actually guide the patient in terms of what to do next, which is a question on a lot of patients' minds. So let's assume the next thing to do is to take an appointment either for a lab test or for seeing a doctor. Today, what usually happens is that we call a receptionist somewhere. The receptionist is probably busy doing 5 other things, and they're taking down the notes, or we call the doctor directly, and the doctor's in the middle of something. Or in some cases, there are apps where we would go into an app and actually try to find the right time, but the app could have many other things in there. So why not just call a virtual receptionist, AI, real-time, voice-based receptionist that has access to all of the calendars of the lab or the doctor, knows what are the available slots, and finds the best slot that suits you. And after the call, sends you an email with the calendar invite for that appointment. This is, again, being done today, really efficient. It saves a lot of time on reception, from the receptionist and from the patients themselves, and at the same time provides a certain level of quality that you can't necessarily gain when you're working with many different people, taking different shifts, etc. So let's say now we've taken the appointment for a lab test. We go and we do the lab test and we get the results. And I'm sure you've been faced with these lab results where you get all this, for the non-medical people in the over here, we get this gibberish of characters and words, but then we get a number within a range, and if it's red or outside of that range, it's highlighted, we pay attention to it, but we don't really understand what's meant with all of these lab results. So wouldn't it be good to have a chatbot that actually comes with the lab results that you can discuss your lab results with? Well, that's exactly what some of our clients are doing right now. You could either upload your lab results to the chatbot, or if the lab has this embedded, you'll get your report on WhatsApp with a link to actually discuss it with a chatbot. And this chatbot will basically ask you questions about your lifestyle, if you're taking any medications, etc. So it also interprets the results in the context of what you're going through today. So if there's some abnormal kind of metric, it might ask you, did you have something sweet to eat before you came to, the night before? And maybe that's affecting your results if your previous results didn't have, an issue. It will probe you to identify if your results are caused by something that's, related to your lifestyle or behavior, or is it something that you should basically dig deeper in and maybe do follow-up tests on, or go see a doctor to make sure that this is being addressed. So this is a really great, helpful tool to help us interpret all kinds of results. Whether it's blood works or scans. This is where AI can play a really good role. So assuming we've found in the lab results that we're vitamin D deficient, which I think most of us are, and we want to go and buy some supplements or some medication from somewhere. Again, you go to these e-commerce sites. They got lots of different products. Which one do you choose? What are the best combinations for you? Again, a chatbot could be really good for helping guide you in terms of the best products, following up on your orders, all kinds of things related to the whole e-commerce experience. This is where chatbots become really helpful to navigate the thousands of products that are available to you on a typical online store. Now, you're taking your medications, you get in touch with the doctor every now and then to follow up. If you have these burning questions and you'd like to just run something by your doctor every now and then, or you've left the doctor's office and then you suddenly remember, oh, I wish I had asked about this, and actually the doctor talked about this thing that I didn't really understand that well. What if you could talk to the doctor's assistant, a virtual AI assistant that's trained on the doctor's methodology, their knowledge base, but also trained on general medicine and the interactions between different elements? What if you could talk to them anytime you have a question, instead of bothering the doctor or not talking to the doctor because you don't want to bother them, or the doctor not responding? This is an opportunity for you to ask any question, clarifies whatever you want to clarify, anytime, all the time. So these are some of the elements where AI today is being used to enhance the patient experience. And when you see these agents in action, you can imagine that now the healthcare team in a typical organization can be just increased in the thousands by using these AI agents, and with the same purpose of serving the patients and the community. And like I said, this is all available today. Of course, there are many, many other touch points within the whole patient journey inside the clinic or hospital, etc., that can also make use of these either chatbots or voice bots or workflows, AI workflows. And I encourage you to give it a try. If you have a healthcare practice, try our one-click voice or a chatbot agent setup. If you go to this site, ai.potential.com/Rachel, you talk to Rachel. Rachel is our AI agent that will guide you through setting up your own voice bot. So within one click, as we say, you can generate your demo voice bot trained on your website or on your practice, and give it a try. It's really easy to set up. It's very cost effective, and you provide amazing service to your patients and to your community at large. So with that, I invite you to reimagine healthcare for the age of AI, and let's make this a much healthier world, and make use of all of the resources we have at our fingertips now. From my end, I'd love to hear from you. We'd all love to hear from you about any topics you'd like us to discuss in upcoming sessions, whether they are industry specific or business function specific, where AI can empower you or your organization or your community. We love talking about this stuff. And if you've got any suggestions, drop us a line in the comments wherever you're listening to this, and we make sure that we'll cover them in the coming sessions. That's it from my end. Hope you have a great day ahead, and look forward to talk soon again.
Thank you, Shadi, for sharing those insights with us. Now let's jump into some quick demonstrations where we'll show you some of our AI tools in action, including agents, coaches, chatbots, workflows, and more. As always, keep your questions coming in the chat. The team will be answering them as we go along. I'll hand it over now to our product and stakeholder teams.
Thank you for calling. Please hold. We've heard that sentence billions of times. We've accepted it like it's normal. But it's not, it's broken. Businesses spend billions every year staffing call centers, and still, customers wait. Agents burn out. Sales get missed. We've automated emails, we've automated ads, but the voice of the business, still stuck in 1999. That's why we created Rachel. She's not a chatbot. She's a voice agent who talks to your customers, answers questions, books appointments, qualifies leads. And here's the twist. She'll help you create your own voice agent in 30 seconds. No devs, no delays, no excuses. So now, the only real question is, why are you still doing this the old way? Talk to Rachel today.
Hey there, I'm Rachel, your super friendly AI sidekick, here to help you set up your very own AI voice agent. Just hit that shiny Talk to Rachel button and we'll get this party started. I'll pop up a quick little form. Just drop in your name, email, website URL, and give your agent a name. As we chat, I'll be building your custom AI voice agent trained on your website content. Your agent will be ready within a minute, and I'll send you an email with a link to test it out, plus all the details you need to get started. Oh, and you get 10 minutes free to try it, no strings attached. Cut your support costs. Let AI handle your calls like a boss while you focus on growing your business.
Before we jump into the Q&A, we have a special offer for you today. Experience our AI voice agent firsthand with a free 10-minute trial and 50% off your first month. Just use the code VOICE50. Don't miss this chance to upgrade your customer interactions. We hope today's demonstrations helped you see what's possible when AI agents are put into action. Whether you're in healthcare or any other field, these tools can be adapted to solve real problems and drive real impact. If you have any ideas or topics you'd like us to cover in future sessions, feel free to share them in the chat. We're here to keep these sessions practical and relevant to your needs. Also, remember to subscribe to our YouTube channel and follow us on LinkedIn to stay updated with all things AI. Thanks again for joining us today, whether you're watching live or tuning in through Zoom. Now, for everyone on Zoom, it's time to open the floor for your questions.